Pork tapeworm, or Taenia solium, is a parasite that infects both pigs and humans. At the moment, there are 5 to 6 million cases worldwide. According to the World Health Organization, pork tapeworm infection is a leading cause of foodborne morbidity and death. In the United States, cysticercosis, an infection that arises when the young form of the tapeworm enters the bloodstream, is considered one of the neglected parasitic infections, or NPIs, a group of 5 parasitic diseases that have been targeted by the United States Center for Disease Control for Public Health Action. Worldwide, the areas that bear the greatest burden of pork tapeworm infection include Latin America, India, and Southeast Asia. In the United States, pork tapeworm disproportionately affects Latin American populations, which may be due to inequities in socioeconomic structure. The significance of pork tapeworm infection as a health issue and its relatively well-documented history warrants international intervention to control its growth.
There are 2 human diseases that can be caused by pork tapeworm. The first is teniasis, which is caused by a person eating raw or undercooked pork infected with tapeworm larvae. The adult tapeworms will settle and live in the small intestine, and then eggs will be regularly released in the human stool. The second disease is cysticercosis, which is caused by a person ingesting tapeworm eggs in human feces. Larvae can spread to muscle, cardiac, and brain tissue. Both pigs and humans can get cysticercosis. Humans with teniasis are more likely to develop cysticercosis by unintentionally ingesting eggs from their own stool.
There are 2 types of diseases caused by pork tapeworm. One of them is teniasis, and the symptoms include having eggs in the stool, abdominal pain, nausea, weight loss, diarrhea, and constipation. The other disease, cysticercosis, depends on the affected tissue in terms of the symptoms. For example, if there's larvae in the brain, they can cause epilepsy and it may require surgery to remove them. As for cures, luckily there is prescription drugs such as praziquantel or nicosamine that can be taken orally to kill the tapeworms.
Pork tapeworm infection is a hard-to-control disease in endemic areas because 1. Pigs are often slaughtered in-house, meaning their meat are immediately cooked after slaughter. 2. Pigs are usually left to roam freely and are not separated from human waste. 3. Cultural traditions often involve eating raw or undercooked pork.
The thermometer will be a dial-style thermometer with a mechanical slot that switches from frowny face to smiley face above a safe cooking temperature. The use of a smiley face is well understood and will be useful in the global application of the thermometer across multicultural backgrounds.